yourselves, kind of what program you're at, and maybe tell a little bit about your program. Does anyone want to go first?
I can go
I can
ahead.
start. I don't care. Oh,
Oh,
go ahead, Whitney.
No, you got it. Go ahead.
I'm Christina Schultz. I'm one of the PGY3s at Western Reserve Hospital in Cuyahoga Falls, Ohio, outside of Akron. We are a small community-based hospital. We take 2 residents a year, um, all primarily DO residents. What else do you want to know?
Maybe just like one fun fact about you or something you're looking forward to in your program.
Fun fact about me, I did ballet for 24 years and now am still trying to keep up with ballet and going to a lot of yoga now recently. And then something I look forward to my program is we like to go to a lot of the national meetings. I'm looking forward to going to Dallas in a couple weeks here.
Fun. Thank you for your introduction, Christina. Whitney, would you like to go now?
Yeah, sure. I can go. Hi, everyone. My name is Whitney Carroll. I am an intern at University Hospitals here in Cleveland, Ohio. I went to med school at Marian University, College of Osteopathic Medicine in Indy. Something unique about my program is that we have 2 level 1 trauma centers. So very busy, very high volume. We get really great operative exposure, which I think is really great for training purposes. And then, fun fact about me is I was born in South Korea.
Very cool. Thank you for your introduction. And Tiana, do you want to go?
Yes. Hi, everybody. I am Tiana. I went to medical school in New Mexico. So I was at Burrell in Las Cruces. And I originally grew up in Colorado. So this is my first time in the Midwest. I am at Farmington Hills, just outside of Detroit at Corwell Farmington or Beaumont. We have like 20 different names. We cover Farmington Hills as well as Dearborn. So kind of our 2 main hospitals. We see a lot of Detroit trauma and have a very good trauma experience, but we're also kind of a community program, but we are a little bit bigger. We have 4 spots per year. And fun fact about me, I played college softball. And what I'm excited for in our program is that we are doing a slow pitch league this spring. So I was drafted first. I'm excited.
I can go next. So I'm Katie. I'm an intern at McLaren Greater Lansing / MSU. A little bit about our program. We take 4 residents a year. My year actually has 3 females and 1 male, so girl power. Let's see. We cover McLaren, which is our level 3, and then Sparrow, which is our level 1. So sometimes we'll be on call at both hospitals, and that's always fun running back and forth between the 2. And so yeah, a lot of good level 1 trauma exposure. We're in the operating room as interns a lot. Like I've already gotten to do like a traction pin, like a nail, stuff like that some other programs, might not get to do until 2nd year. Fun fact about me, let's see. I have a really cute cat named Allie. She was just here. Let's see. Here. This is Allie. She's very fluffy. And I also got a 2nd cat named Callie, but she's very shy. And then something I'm looking forward to in our program, finding out who our interns are. And also, we have a resident golf outing every year. So it gets very competitive. So I'm excited for that.
Perfect. Thank you guys for your introductions. So we were also going to have Briley Schaefer on tonight, but she unfortunately can't make it. Okay. Are we ready to get started? Okay, so I'm just gonna ask some questions, and if you guys just want to answer them, kind of the general ones would be good to get an answer from you, but if you prefer not to answer a question, no biggie. Okay, very first question. What inspired you to choose orthopedic surgery as your specialty?
I can start off with this one. So I have a interesting background where I used to be a surgical tech. So going through scrub tech school, like getting exposure to all the different surgical subspecialties, I was like, yeah, I definitely want to do surgery. And ortho was just like super awesome, relatively quick procedures, relatively good outcomes. And then in med school, just like I worked in labor and delivery as well before med school, and I knew, so I was like, okay, ortho or OBGYN, because you get surgery with OBGYN as well, but ultimately I really hated GYN. It just wasn't for me. And I didn't really like the whole continuity of care and all that stuff. I like to see my patients, help them get better and then send them on their way. So yeah, really ended up choosing ortho. I didn't like gen surge because it was just too much like butts and guts and it wasn't exhilarating and stuff. But yeah, I think with ortho you can really help people get their mobility back. And of course, I used to be a competitive figure skater as well, so mobility is something that's really important to me. Um, and yeah, you generally have good outcomes and kind of like that instant gratification. See you fracture, you fix it, and then you did your job. So
I will say if you are a third year kind of getting ready for auditions, like you have to have a rehearsed answer to that. Especially like as a girl, you're gonna go to all these programs and they're gonna be a bunch of guys and they're gonna be like, oh, well, why do you want to do ortho? And I think a lot of us have the same like kind of activity athlete background. Like we hear that all the time, but be able to kind of do what she just said and have a background, but give a reason why you like it and show that you've like thought about it and what you like about it is very memorable. Versus like we get guys and girls coming in all the time and they're like, oh, I was a college athlete, so I liked ortho. And you're like, okay, cool. Like we're not going to knock you for it. We don't blame you at all. But being able to articulate why you want to do it and like give us a few reasons goes a lot longer and is a little bit more meaningful. And that's going to be every place you go to is going to ask you when you get to interviews, they're going to ask you. So having a good answer to that is definitely something to be prepared for as an auditioning student coming up.
Yeah, I think that's a really good point. I think for me, I actually was really interested in peds. I wanted to do hemonc. I was actually an onc patient in high school. I was actually orthopedic oncology. So basically, I had like a really rare tumor. They had to take it out. I had a drop foot because they took out my peroneal nerve. And I was like 15. I wanted to swim. So kind of had to change like my life trajectory because of everything. Then I had a reconstructive tendon transfer and I debated like PA school, I liked healthcare and all that stuff. I had an internship though, and I was like, okay, I want to go to medical school. Like I said, was interested in peds, and then I actually ended up meeting my neighbor who does orthopedic oncology, and he's just like the nicest, like super chill guy. And he asked me, hey, if you ever want to come hang out with me in the OR, would love to have you. So he taught me how to scrub in as like a first year, and he was very low pressure, but I just always found myself like really enjoying the OR, and I really try to talk myself out of it because I'm like, surgery's not for me. I don't want to do that. And then I just honestly like absolutely fell in love with it. And because I have like such a personal connection like with orthopedics and truly like with every step I take, I'm like reminded of the field and all the amazing things it can do for people. And you really can, save people's like limbs, their mobility, and honestly like their livelihood. And so that's like really cool for me to kind of really remember that, especially like on those long call nights and things like that. I'm really able to kind of remember why I chose this field in the first place because, people have an injury, they, rely on you to fix it and ultimately you help them get better. So that's how I ended up here.
Similar answer to everybody else. Like I said, I did ballet growing up, so I really liked anatomy and movement, and how the interplay between everything. So orthopedics, I always kind of knew I wanted to go into orthopedics starting in college and in medical school. So I really tried to maximize those experiences early on. But I like how orthopedics people can come in either injured or they're in pain from arthritis, and you can either fix a fracture, give them a new joint, and really restore their mobility and restore their life back to movement. So people who are coming in hurt and can't really walk anymore, can't really move anymore, you can really help them in a large way and get them back to movement, back to life, and enjoying life again.
Okay. And so the next question would be, has anyone had any pivotal moments in their medical journey that kind of shaped your career?
Yeah, I can answer that because, like I said, I initially thought I was going to do peds and do like peds hemonc. So I kind of had this like realization. It was actually my third year of med school. So I was a little bit later to the game because I feel like a lot of people kind of come into med school like, oh, I'm going to do ortho day one. And like I was very not like that. So I actually had, it was my first, general surgery rotation out at a very small like community hospital, and it was just me and like the local orthopedic surgeon, and his PA was getting married, so she was gone for a few weeks. So I was, kind of a fresh third year med student. It was just me and him in the OR, pretty much every day, and he let me do a few things, and I was like, wow, this is really cool. And I remember like I like couldn't sleep because I'm like, wait a second, I was gonna do peds, I had this whole plan, I was gonna do this. And I think for me, I just realized like how much I loved operating and actually like physically seeing people get better. And that was kind of like my light bulb moment, because of course I had all this self-doubt. I'm like, I'm not smart enough, I'm not, qualified enough, I don't have all of these things that like I envisioned like an orthopedic surgeon having. But that really realization just really kind of pushed me to work a lot harder and study a lot harder, and really perform on my auditions. And I think that's why I was able to match, because I kind of just like made up for it with my work ethic. So I think kind of having that realization was like good motivation to kind of get to where I wanted to be.
I think one of the things as a student and going through, you're like try to figure out what you want to do and make sure it's what you want to do, because you don't, heaven forbid, you pick wrong, and I like went through and I never had a moment where I was like, this is the career for me, like this is all I can see myself doing. Like there were multiple rotations that I was like, I like this, I could do this, it's interesting, I find it fun. And when I kind of got to the end of my third year, I did more surgery stuff because I knew I kind of wanted to be doing something with my hands and didn't know what specialty exactly. But I had a mentor that was really great and would like just sit down and talk to me. And he was an ortho guy, and he was telling me about his residency and his experiences through it and how he still hangs out with people from residency. And if he has a complicated case, because I was in rural New Mexico, if he has something he hasn't seen before, he like reaches out to those guys and talks to him all the time. And one of the things that kind of helped me pick ortho was like, these are the people I want to work with every single day. And residency is hard. And these were the people that I wanted to go into the hospital with and be around and like I kind of fit in with. So not only it wasn't like a epiphany of I want to do this every day, but it was like I could go into work and have a really bad day. But the ortho team and from the scrub techs to the nurses, it like attracts a certain kind of people. And those were the people I wanted to be around every day.
Kind of going off that too, I think it's really important just to have some mentors that you can find throughout the whole thing. Like other people were saying, since I kind of knew I wanted to go into ortho a little bit earlier on, I was reaching out to people because I was in Athens, Ohio, so smaller area. And there was a private practice guy there that basically just let me scrub with him when I had free time, with classes. And then there was a doc in Cincinnati that I got really close with. He was a great mentor for me. Again, we'll probably talk about this later on, but like I didn't have great board scores. I didn't have the most research, kind of like what Whitney was saying. I think really your auditions are what's going to make you stand out, and shine, and really that work ethic, and say, yeah, this is something you can do. This is, a great opportunity to connect with us as women in ortho. I remember one pivotal moment was when I was auditioning, and one of our spine surgeons looked at me, he goes, what do you want to do? And I said, ortho. He said, are you strong enough to do ortho, or can you really do ortho? And the resident I was with, one of my chiefs now, like jumped in right away and was like, I think I was there for a week. And he was like, yeah, she's doing a great job, and like stood up for me right away. So it's really important just to kind of make those relationships and have those mentors, and really you can do whatever you want to do.
Okay, does anyone have anything else they'd like to say about any other pivotal moments? If so, I can ask the next question as well. Okay, and kind of going off of Christina's question about kind of making those connections. How would you guys approach connecting to other women in the field? Because it can be pretty intimidating for a lot of students to kind of like make those connections, especially when you're first starting out.
So I'll say like Christina is one of the first people I met that was like a fourth year, like a female going to ortho. And I met her at an SA or an AOAO conference. And so that's kind of how I got my foot in the door with like networking and meeting other females in ortho. So highly recommend going to those conferences and you just kind of, end up in random places and talking to people you never would have expected to, making some really awesome connections. But besides that, like cold emailing is always an option. Like I'm sure you guys have heard of Dr. Ariana Giannaco. She's a really cool, like good foot and ankle surgeon who is a DO and works at Yale now, but like I just cold emailed her one time and like she got back to me and we like set up a Zoom call and stuff like that. So that always works. But obviously like you guys have us as a network, like being on the Zoom call, and I'm sure we'll all drop our emails so you guys can ask us questions or anything like that. But yeah, that's kind of how I found mentors and whatnot.
I was at Burrell, so we have not a single residency associated with us. I think we had like 4 ortho matches previously, like before me. So we were very small. But something that I didn't really appreciate as a student and definitely see on the other side of resident now is like it's such a small world in the DO ortho world. And you'll see that when you go on auditions. And you'll see that the more you kind of reach out, and it takes like one person to kind of know and speak up to you on your behalf and can get you in touch with other people. Because I know, residents at all of the programs in Michigan now and all the places I went and auditioned at, like I auditioned with Briley down at Kettering and she was like, I've talked to her since matching and things like that. So you meet all these people and it's such a tight knit community, especially I think like the women within ortho, especially from the DO community. So you reach out to one of us and you say, hey, I really like this program. Do you know anyone there? And they'll be like, yeah, I can get you in touch. Or, hey, I know there's a girl down at Doctors. And I'm like, I talk to those girls every week. So it's like, once you kind of put your foot out there and get a foot in the door, it goes a long way. And you have to remember, it's like scary for you guys, but we have all been in your shoes and we've done it and we know what it's like. And I think we all got here from working so hard that we love helping other people too. So don't feel like you're a nuisance. If you don't get a response, we probably missed the email, to be honest. Like, don't think anything bad of it. It's okay to reach out again. And just remember, like, we've been there. We know what you're going through. And we all just kind of want to help. So don't be afraid to do it.
Yeah, kind of like piggybacking off of everything that's been said. Something that I did that I thought was really helpful. Also, too, I think it's important. Like, obviously, I think it's great to have like, female orthopedic mentors, but something that I really appreciated too, like even at my program, like even some of my male attendings are like, hey, they're decades older than me. They're like, hey, like if you need a mentor and you're interested in this, like you can come to me. Like I don't want you to feel like you have to just connect with other women. Like you are in this program, we want to see you succeed. So I think it's good to find a program where, it's awesome to have other female co-residents, but like I've truly found that everyone's very welcoming. I know it can be like a really intimidating field, but I think it's been a lot more normal than I expected it to be. Also too, like with my med school, I don't know if each school is a little different. We have like an alumni page for all of our like past matches and whatnot. So I kind of looked through to see who had matched in orthopedic surgery. And I started doing this as a 3 once I was pretty interested in ortho. And like kind of Kimi was talking about, I just started emailing people. I set up phone calls, just kind of gathered different information, especially about residency programs and setting up my auditions. But I found that the whole community, everyone's really nice and really helpful because we've all kind of gotten here because of other people. So if you can kind of like connect with some alumni from your medical school, I think that's also super helpful.
Yeah, I agree with everything that's been said. Like, I think it's just important to have a mentor in general. Yes, it's nice to have a female mentor. I just went to yoga with one of my attendings before this. So it's always good to build those relationships like outside of the hospital as well. Just to have someone to talk to about ortho, about life. But again, like everyone in the AOAO community is so welcoming. Dr. C's is another great resource. You can reach out to her and she'll put you in connection with so many people. But really just reaching out to people on Instagram, on email, I think is just, you just have to make that connection. And like Whitney said, or I don't forget who it was, Whitney or Tiana, if we don't respond, just text us, email us again. I am so bad at responding sometimes. So if I'm on call, I'm probably not going to respond right away. So just keep reaching out till we respond.
Kind of going off of that, like what's the best way to keep the connection? Like, because we can reach out to you guys or reach out to mentors like once or twice asking a question. How do you keep, where do you draw the line of like messaging you guys, asking like how you guys are, or like keeping that mentorship going for the years coming as being like a earlier like M2 right now?
Yeah, I totally get what you're saying. I know I'm the type of person where I hate being like a bother or burden to other people. And even just initially reaching out to people, I was pretty nervous because I'm like, I don't want to bother these people. They're busy. They have no idea who I am. But like I said, I found that everyone's really kind, honestly. So I think it's very reasonable to like shoot someone an email. I always kind of give people my phone number pretty quickly because it's way faster for me to text. And like we all get busy, texts get buried and whatnot. But I always tell people, I'm like, if I don't respond, just text me again. I won't be like, oh my God, this person texted me again. Like it's genuinely because I got busy. But I think, just checking in every once in a while, you don't even have to ask a question, but just be like, hey, thinking of you, like hope, that if someone texted me that would just absolutely make my day. If, if even if you're, first year, second year student, if someone was like, hey, thinking of you, like hope you're having a good day or you're liking your rotation or whatever, you don't have to always be kind of asking for things, but I think it's good to just kind of keep tabs in a way. So like you said, you can kind of not feel as, weird reaching out when you actually like need some help too. But I totally get what you mean. It's kind of a hard balance, but once you kind of, establish those initial relationships, I think it should feel like a friendship, I think too.
Okay. And I think a really good next question would be, how do you guys manage to balance maybe family, personal life with your busy residency schedules?
I think it's really important to just make time for what you want to do. Like no matter what in life, if it's residency, if it's another job, you're always going to have things to do with work. So I think it's really just important to like understand that yes, like there are days where you're gonna be at the hospital later than you want to be. But if like working out is something that you want to do, or spending time with family, or I don't know if people have kids, things like that. That's just important to like make the time for what you want because you're gonna want to come home and lay on the couch and not do anything and just go to sleep. But if it's something that like you truly want to prioritize, like you will make time for it. So I think it's really important just like schedule that time and understand that yes, you're gonna be tired, you're gonna not want to do anything. But if it's something that's important to you, like you'll put the time in or you'll make that schedule time. So like something that I always do is I pretty consistently go to work out, go to yoga every Saturday and Sunday when I'm not on call. It's like I always have those classes scheduled. Like I know it's like okay, like I'm gonna get up and I'm gonna go. Or I have a good group of friends. Like every Friday night, we pretty much go out to dinner, have a drink, and just kind of catch up from the week. So that's just kind of like our standing time to make sure that we all make the time to hang out and kind of relax a little bit too.
Yeah, I'm with Christina on that. You just kind of schedule it into your schedule. So like if I know I have a clinic day, I'm like, okay, I'm gonna be done at 5. That means I can make a workout class at like 6 or 6:30 or something like that. But obviously if I'm on call or something, I'm like, okay, I'm not gonna get to work out today. Or if I have a long OR day and kind of things like that. So having like being in clinic or like knowing that you have a shorter OR day or something, that's then you can kind of squeeze those things in there. And like I don't have a partner or kids or anything like that, but I know a lot of people definitely are like, okay, like when I get home, like home is home and that's what I'm doing. I'm not doing any work with me. So a lot of my other co-residents have kids and everything like that. So like if they have random free time during the day, they'll like stay at the hospital, study, make sure they get all their work done, then go home and just so their kids and families have their undivided attention like that. And like I feel like depending on whatever service you're on at whatever program you're with, like there's ebbs and flows of when you're super busy. Like if you're on trauma, you're gonna be operating long days and stuff like that. But if you're in on peds or something, like our peds here in town is a little lighter and it's a lot of clinics. So it's like, okay, I have more time and stuff like that. So there's always an ebb and flow, but really it's just making sure that you schedule those things. And also for me, getting through really hard times, I always schedule fun trips in advance. I'm like, okay, like I have this to look forward to in the next 3 weeks or next month or something like that. And that's kind of how I got through med school too, was just like booking fun things here and there. And I'm like, maybe I shouldn't have spent that money, but you know, it's what's going to make me happy and kind of get me through and motivate me. So totally worth it.
Yeah, I totally echo like everything that's been said. I think something that like Kimi was talking about that got me through like med school and now residency is just kind of balance in general. So I think also too, like you need to do all the basic things like sleeping enough, you know, drinking water, eating, exercising, seeing the sun, which we don't really get a lot of here in Cleveland. So I'm like, anytime the sun's out, I'm like, I'm going on a walk. I don't care. So I think doing all those basic things is really important, but you got to find what makes you happy and feels like recharged. And I think every day looks different, exactly like you were saying. You know, some weekends I like go to a workout class or I go out with my girlfriends or visit my parents. You just kind of have to like do all these different things. And I think you're never going to feel like fully balanced or fully on top of everything. Like, I feel like as residents, we have research, we have studying, we have case prep, we have friends. Like, you have so many different boxes you're checking. And you're just always going to feel behind. But that's just, you know, it's kind of what we signed up for. And I think you need to really just be like patient with yourself and kind of do a check in and be like, okay, am I happy with this? Am I, you know, feeling okay with this? And just kind of having like that self reflection is really important too. And I know like when I first moved to Cleveland, like, and honestly through most of med school, like I wasn't dating anyone. I didn't have a partner. Like I was able to go on dates and stuff in the fall. I ended up like meeting my boyfriend. Like if any of you are not with anyone right now, do not worry. Like you have time. Like that was something I was super worried about, like going into residency. And I don't know if that's something people want to talk about more, but I felt like everyone was engaged, married, had kids. I'm like, oh my God, I'm just gonna work all the time and die alone. But like there's like you have like so much time to like really kind of work on other aspects of your life. Like yes, work is busy. But I think too, just finding that balance is like super important and will help you like in the long term for sure.
And I will say the thing that you kind of don't think about as a med student, you hear about how many hours you work as a resident and the schedule, and you know it's going to be hard, but it's finally what you want to be doing. So it's like we are now taking solo call, and it's like that's terrifying. My schedule is so much worse, but like it's so exciting to like get to be on your own now and be given freedom and responsibility and this like what you've been working your whole life to do. And it's still exciting. So even when you have long days, you know, you're still seeing stuff for the first time, you're getting to do more every day, that it makes it worth it. And for me, it's much more rewarding than studying for 2 weeks and taking an exam every 2 weeks. Like I feel like in med school, you always felt like there was a new hurdle and you didn't get as much back, but like you worked your whole life to get to this point, to learn these things, to get these opportunities. So it makes it so much more bearable, in my opinion. And then you schedule stuff, you know, outside of it when you can, and when you get done with the day, if you get a day off early, awesome, you can go and do things. And I think ortho can be variable with your rotation. So it's nice, you know, if you're on hand, you can chill a little bit versus if you're on trauma, and there's a lot of variety in what we do. And then like my seniors right now are chilling. They're not taking call anymore. Like our fives are studying for boards and operating, and that's it. And I'm like, oh, there's a light at the end of the tunnel. You just kind of got to get there.
If anyone has any questions or follow-up questions to any of the residents' responses, just feel free to either type in the chat or you guys can unmute yourself. So yeah, I think the next thing I'd like to kind of move into is maybe talking about any difficult like situations or just navigating the field of orthopedic surgery as it is traditionally male dominated.
I've definitely gotten the like, oh, can I speak to the doctor? And I'm like, excuse me, I am the doctor that you're speaking to right now. And so you kind of just have to like bite your tongue and just say like, no, I'm the doctor, like this is the plan, this is what we're doing, and kind of tell patients a lot of stuff like that. But there was one time where it was really annoying. So we have this whole fiasco with like how to get stuff for our traction pins and stuff. And it was at one point we were going down to Central and just like getting like literally a Shrikery and like the trays ourselves. And it was just very inefficient. And we'd been doing that for like months, honestly. There's like a cart that we're supposed to use, but they were trying to institute like us using the cart and this disposable drill, which honestly sucks. And so I went down there during a day one day, like, hey, like I need stuff for a traction pin. And one of the SPD people were like, okay, like cool, like I'll get it for you. He's really nice. And then the manager came around and was like, what are you doing? Like, why are you giving that to her? And I was like, I need this because I need to put a traction pin in someone in the ED. And she's like, you can't do that. I'm like, we literally do this all the time and no one gives me any issues. And so then she's like, giving me a really hard time. I'm like, look, this is affecting patient care. Like, I need to go do this and I need the equipment that we need to do it. And the cart doesn't have what we need. And so I called, we take buddy call as an intern. So I called the two that I was on call with and I was like, hey, like they're giving me a hard time. Like, can you come down here and help me out? And of course, like he comes down and he looks like your typical ortho bro and everything gets resolved. And I'm like, this is just really annoying. And so that's unfortunately some of the things that you'll have to deal with. Hopefully not, but like it's happened to Alexandra, my other cars in Alexandra, where like nurses and stuff kind of don't exactly respect her because she's a female and are like, no, like I think I know better than you. Like she was just on ICU and had a really rough time with some of the nurses and other staff. And like she made a mistake, a simple mistake that, just intern things that we all do, and kind of got like pretty much berated by one of the staff in the ICU. And it was just like, that would have never happened with a male resident because she was one of the only females working at that time. And so it's just like those little things that are really frustrating, but unfortunately it comes up. And, I also think it makes us stronger as physicians and having to kind of handle all of that stuff, but you got to just handle it with grace and try to move on and respectfully kind of tell people your role and hope that, it doesn't run into issues later.
I agree. I feel like the hardest part so far as a resident has kind of been a lot of like the female staff, whether it's scrub nurses, ER nurses, like unfortunately it has been the other females that make it hard, and the boys walk in and they like absolutely love their ortho boys and kiss their asses. And I'm like, what do I got to do over here? I can't sweet talk you like these boys can. So like for now we can't change it. We can't do anything about it. So you just have to be very mindful of it. And I go absolutely out of my way to be so nice to them and like stop and talk to them so that they know who I am. So that when I come in, they recognize all of these ortho boys, and then they see me and they're like, is this a student? Is this like, we have no idea what's going on. So like you make an effort to kind of put your best foot forward. And I feel like as a student, it's really hard. And right now, like as an intern, as a younger resident, you can't really change that culture yet. You just kind of have to suck it up, grit your teeth, and make the best relationships you can with those people, and hope that as we get older, they kind of learn to respect us more and things change. But I think, the biggest part of that also is that the people in our program will stick up for you and go look for a place. Like Christina said, when they're like, oh, do you really want to be here? And one of her upper residents was like, yeah, she's going to do great. Like that's the culture you want. You want somewhere where they're going to look at you and happy to have you as a resident, and not just because you're a female. And, I think you get the vibe very early on when you're an auditioning student, what kind of programs are like that versus what programs like see you as a girl in their program. And you just want to be there and be a resident and be respected like everybody else. I think as a student, I definitely had like 2 or 3 places I auditioned at that like they were very much that vibe, and they're like, well, why would you want to be here? This is the boys' world. And you just have to take it with a grain of salt and not even give them a reaction, because if you give them anything or you kind of get an attitude about it, then they're like, oh, well, that's why we don't want a girl. So, you just kind of have tough skin and you get through it. And then a lot of the times these guys do this to you, and there'll be attendings and they kind of give you this big front. And then as long as you don't respond or give them any reaction, then they kind of like open up and they're like, oh, this person can take it. Like now they're okay. And I think they do it to the boys too. They push on them, they pick on them, and the boys just are used to it. and don't say anything. So I don't think anything about it. And they're not doing it for any reason other than maybe makes them feel better, but it's kind of just something you have to put up with, in my opinion. And, I think a lot of the times after that, if you kind of stand your ground and say, I wanted to be here, I deserve to be here, then they're like, oh, okay, cool. Yeah, she does. And they'll give you a chance to prove that. It's definitely part of it. I saw very minimal of it, I feel like. But yeah, sorry, now I'm just rambling.
Yeah, I think my whole kind of approach is I really try and kill people with kindness. Like I always try and be super kind to people, which gets hard, like, when you're tired, you're stressed. But I think it's always really important to remember that you're all on the same team. And that's what I always kind of have to remind myself. Like if I get heated because someone's calling me a nurse and I'm like 3 consults behind, I'm like, that is the last thing I need to be hearing right now. Like you got to keep it cool. You cannot be like super emotional, especially as a woman. Like you really have to keep it together, even more so than your male counterparts. I had an experience in the OR where I was with one of my attendings, who's actually like our chief of ortho trauma here, and one of the scrub techs. She's been around for forever. She was literally trying to like box me out from standing next to him. And he stopped what he was doing. I didn't say anything. I just kind of backed up. I was like, you know what? This is her space, whatever. And he stopped and looked at her and he goes, are you trying to box out my intern? She's the thing against women, especially blondes. Like she hates every blonde that we have in this program. I don't understand. And the fact that like this man who is very respected, very well known, like stood up for me, like one of his interns, was like super, super cool. And we talked about it later. He's like, I'm so sorry that happened. She always does this. It drives me crazy. Thank you for, not reacting and keeping your cool. So I think he knew that I saw what was happening, but you just really have to be professional. And kind of like what Emily, I know you just dropped your question in the chat here. I think it's hard, especially on auditions as well, going like you're at so many different facilities, hospitals, ORs, like, you're nervous because you're trying to perform. Like there's a lot going on and it's very stressful. I mean, even as an intern, like I matched, I have a program and all these things. And every single time I go into an OR with someone I don't know, I walk in, I introduce myself, I pull my gloves. Like I still do all those basic things. I help prep the patient. I help take the drapes down at the end of surgery. Like I am not above doing any of that stuff. And I think too, the nursing staff, like anesthesia, everyone really appreciates a team player. And you do kind of have to play into it a little bit more because it is typically more female staff. It's a weird dynamic. And even my sister is an ICU nurse and she and I have kind of gotten into it. She's like, oh, I hate these residents. I'm like, well, you need to respect what they're saying, like they're physician. It's all about communication and respect. So like I said, you just kind of need to know your place and kind of move carefully. But even doing like the little things, like if say the circulator is trying to get like the suction and everything set up, and you see that someone else is scrubbing in, like I help like people scrub all the time. You just close their jackets, you help do all of the little things that need to get done. But like being respectful and just kind of clearly communicating things, like letting people know who you are, which sounds basic, like that really makes people mad. If you just walk in the room and expect things to be pulled for you, that's how you're going to make enemies. So being really kind and just kind of respectful and just aware of your surroundings is kind of the best way to go about things, in my opinion.
Yeah, I agree with that. Like you're always probably going to be asked, are you a nurse? Are you old enough to be a doctor? Like how old are you? How long have you been doing this? Like you look like you're 15. So you just have to take it with a grain of salt. Like I'm sure everyone's going to appreciate this later on. When we're a little bit older, we still look young. But I think what everyone else was saying, just be respectful, be nice. Like don't be the resident or med student that comes in as the patient's draped. Like be in there, be helpful, ask everyone else what you can do to help them set up, like help get the patient set up. Like I think it is sometimes interesting to see some of the male counterparts just walk in with patients like almost draped and ready to go, where it's like you're going to be in there like helping with like a spinal or helping them just get positioned, help drape, pull your own gloves. Like I think it really does go far. You're going to get some pushback no matter what from some of the nursing staff. There's one of the scrub nurses at one of my hospitals, which I don't know what I did, but she does not like me. But only thing you can do is just kill her with kindness, like talk to her, talk to them about, ask them about their grandkids and everything else. So it's really just important just to really make those connections because you never know like who you're going to be with next. Like especially too, like when you're down in the ER or like the nursing staff on the floors. Like if you respond to your pages, respond to their messages, they're going to like you so much better and they won't bother you as much. If they know, like there are some times where I call back a page on the weekend, they're like, oh, it's you. Like, I'm so happy. Like, this is what I need. Like, I know you're gonna put it in, be done. And like, they're just so much happier when they know that like I'm on for the weekend or like in the ER, like just having good communication skills. Like, once you get the consult, you go talk to the ER doc, tell them this is what your plan is. And then they're not paging you, being like, are you gonna come down here? And then it's like, well, I already snuck in, snuck out. So just really building those relationships with all the other like nursing staff, ER docs, other physicians, because it really does go a long way. And like we, as Western Reserve residents, we go up to UH, like we go to Metro, we go to Akron Children. So we're interacting with many other different programs. And so it's always good to build relationships with those residents as well, because you're going to be working with them on other rotations. They're going to be your chiefs later on. So if you already kind of have a good relationship from when you were a younger resident, like that they know you're going to work hard. If they're making your schedule, they might be a little bit nicer to you, or not nicer, but like put you on some things that you want to do. So it's really just important to kind of build those relationships and make those connections just from when you're on rotation, but also like later down in life. Like there's some UH residents that I can text and like we were hanging out at Metro that I'm going to be with from Cleveland Clinic down at Akron Children. So like it just makes all of your rotations more enjoyable too, if you like who you're working with.
I think we said a little bit of it, but the question in the chat, like the best thing to do, I think as a student is to walk in and like what you said, communication is key. Like I always kind of had the thought of when I first started rotation, you kind of got to learn how everything works. People do things differently, but kind of it's better to be seen than heard was my thing. So like I would go in, I'd introduce myself, be like, hey, I'm a med student here. Like I'm just trying to stay out of your way. And I kind of always joke about it because that's just what I did. And the nurses would always appreciate it. They want to meet you. You know, they see students all the time. So it's not like it's anything new for them, but just being able to go in and be like, hey, I'm new here. Like try to stay out of your way. Like, let me know if I can do absolutely anything for you. But then I think one of the legs up we have as women is like to be more observant, because the boys go in there and they stand in the OR and half the time they look like they're going to fall asleep. So like learning where they keep the blankets and knowing that they're going to grab this to like set up next, like learning those things can go so far. And then your second week when you've been there, everyone knows you've worked with this surgeon before or this resident, and you know they like are going to need something and you don't see it and you grab it, like that goes a long way to us. And same thing, I think as a student, when you're in the ER is kind of your best way to help. So if you know they're going to do a cast and they are going to go interview the patient, be like, hey, I can go grab this for you. Like, do you want anything specific? Like that shows you know what's going on. It shows you're paying attention, and it goes such a long way in one helping us out, but also to know that what you know what's going on, you paid attention last week. So you kind of have that going for you. That's one of your secret weapons. The boys mostly just kind of follow you around. So that's one thing you guys have going into it that I think is an advantage, and definitely use it.
I kind of have a quick question that I got in the chat, and it's just kind of talking about how many hours you guys work a week. There's been so many things floating around the internet and kind of some stigmas that, oh, you work a jillion hours. Could you guys maybe expand on what your average week looks like, maybe even through different rotations?
I feel like for me, I'll go through an average day. So if I'm on like, let's see, like sports or something, or like joints, I don't know, I'll wake up at like, I also live like 5 minutes away from our level 1 and then 10 minutes away from McLaren. So I live pretty close to the hospital. So I don't know, depending on how many patients I have to round on, let's say I have like 3 patients to round on. I'll get up at like, I'll set an alarm at 5. I snooze a lot. So I'll set an alarm at 5, snooze, wake up at like 5:15. I just like kind of get myself, wash my face, brush my teeth, make a coffee, get changed, go to the hospital, see my patients, and then we have sign out at 6:30. So usually like I like to have all my notes done by then. And we sign out from 6:30 till 7, where talk about all the patients on the list, go over any reductions from the night before or from the weekend. And then from 7 to 8 is education. We have education every day, from 7 to 8 a.m. And then Fridays is 7 to 9. So we're in there, and then I'll go to my cases. For the rest of the day, sometimes, you get out like 3, 4 o'clock if you're on sports. Joints, if it's like a nice fast day, you'll be done by like 3. Sometimes it's 6. It all kind of varies and stuff like that. And then obviously like go home, prep the next day. And then sometimes if I'm on call, we don't have any post-call days at my program. And so I'll be coming straight from cases to call or clinic. I'll get to go home for like a little bit, go to call. Call starts at 6 p.m. for us. Kind of see what's pending in the ED. Usually, it's, if we're covering Sparrow, it's pretty steady. Usually, sometimes I'm a white cloud, so I get lucky sometimes and there's nothing, which has happened before and everyone kind of hates me for it, but I've also gotten slammed. And so yeah, just kind of staying up doing consults all night. And then we get to pick our call schedule as interns, which is really nice since we're still on buddy call. And so we all kind of try to work with each other to make sure we get like a post-call clinic day, because we only have to do a half day of clinic if we're on call the night before. But if we're in the OR, you're in the OR all day. So we try to work with each other to see if that happens. But yeah, otherwise if I get like 2 hours of sleep on call, great. If not, oh well, a lot of energy drinks to get you through. And yeah, that's kind of like a typical like day, 2 days and stuff. So I don't know. I mean, I try to accurately log my hours, but that doesn't always happen because I just forget. So I just do like 7 to 7.
Yeah, I think for us, it definitely kind of varies what rotation you're on. As interns at my program, we do 6 months of orthopedic rotations and then 6 months of like off service or non-orthopedic rotations. When we're on service, kind of like Kimi already touched on, it really depends on like the service, like more elective things like joint sports, you're typically done a little bit earlier. It depends if you're in clinic in the OR and whatnot. But I think for me, the biggest kind of realization or kind of yeah, I guess realization is a good word. I didn't really know what call was like. I actually didn't rotate at my program. I just interviewed here. Obviously elected enough to end up here. But for us, like as interns, we do buddy call on the weekends. So when you're on service, so 6 months out of the year, except for when we do 2 months of orthopedic trauma, you do not take weekend call. So we do call pretty much like 2 out of the 4 weekends when you're on service. So for me, I worked I was on joints, for example, in August. So I worked a normal week, alternating between clinic and the OR. And then we either do weekend call, you work overnight, Friday night, and then Sunday, like 6 a.m. to 6 p.m., or you do a 24 on Saturday, 6 a.m. to like 6 a.m. on Sunday. So I think for me, that was, a pretty big adjustment because I went from working a whole week in joints. I was tired. And then I went in and worked overnight. We got absolutely crushed. Like I'm a black cloud, so it's probably my fault. But we were up all night. We had all these crazy consults. And I was up for like 30 hours, which that was definitely an exception, but it happened. And I was like, wow, this is just something I have to get used to. And then we start taking like primary call, meaning we do solo call as second years. So that's coming up very fast. But yeah, typically we just do like the weekend call. So when you have a call weekend, it's obviously very busy, but that's why you really have to kind of be smart with your time when you're off to kind of catch up on life things. But overall, I would say, especially as an intern, it's been very balanced. Like I've had, when you're on trauma, it's busy. I'm getting up at 3:30 in the morning. I have to go do all these things. I might get home at 11 p.m., but not every single day is like that. Because then you have like radiology, PM&R, you have all these other things that really, I think, kind of help balance it out. So it varies, but I think it's personally been like very manageable. Some weeks are just a lot busier than others.
Like everyone else has kind of said, it really just varies on what you're doing. Intern year, you're probably sometimes you might be at the hospital longer just because it takes you longer to do things. So you're still trying to figure everything out. Second year, you're getting into the swing of things. You can start seeing consults a little bit faster. Third year again, like you pretty much have things down in terms of seeing consults and knowing kind of what you're doing, but now you're starting to teach other people. So I think your time just also varies based on what year you are, what rotations you're on. Again, like if you're on radiology for your off service, your intern year, you're probably gonna be at the hospital like 8 to noon. Like, so it definitely those rotations balance out the other times where you're on trauma. For my program, we're home call. So that means like we'll hold the pager and be on call at night. And then we don't get a post call day. So when we're up at Metro, we're 24-hour call in the hospital, and then you get a post call day afterwards. So it really just kind of depends on how your program's set up for call. For us at Western Reserve, we don't get a ton of overnight calls, but every once in a while you will. And then you're stuck at the hospital or in the OR all day the next day, just thinking about when you can go home and go to bed. But there's plenty of other times where you won't get a call in the middle of the night and you're just sleeping the rest of the night. So I think it really just kind of balances out, and also based on the season and what rotation you're on too. So like I think last week I probably worked 85 hours, but it was also just because I was on call on the weekend. But we only take 1 weekend of call a month. So this week I'll probably average closer to the 60, 70 hour mark. So I think it just really kind of averages out throughout your residency, throughout the months.
Yeah, and like I said earlier, like I think most of these programs, if you go in and you talk to anyone and they're gonna say, first year, second year is a grind. It's hard. I think it's pretty much that way universally across ortho programs. And you just kind of have to know that you go into it and it's expected of you. You have so much to learn those 2 years. A lot of those 2 years where you're doing a lot of trauma and a lot of call to be able to get your reductions, to see things. And then as you get older, it's less call, more operating. And that's how you want it to be when you're a 5. You don't want to be taking 3 weekends a month. You want to be in the OR or at home with your family or doing other things. So it's just kind of the way most of these programs are set up. And that's how ours is. First 2 years, are going to be hard. You work a lot. Our second year is definitely the worst. And then third year sounds amazing. Can't wait.
Okay. I think we're going to end on one last question. And then if you guys would feel comfortable sharing your contact information, just in case if anyone has any extra questions, you guys can put that in the chat. Last question is, what advice would you, sorry, I just lost my train of thought. What advice did you guys get from other women ortho mentors, either as a resident or med student, that really resonated with you guys?
I think something is just like what everyone's been saying is just if this is something you want to do, you will make it happen. Like you just got to put the time in, you got to put the work in, you got to know your stuff. Like just because you're female doesn't mean you're not going to get in, or doesn't mean that you're going to get in because they need females. I had a medical student tell me that if I match at a certain program, it's only going to be because that attending wants a female. And that's the only reason I'm going to get in. But again, you just got to work your butt off. You got to just do the work. You just got to be a competitive person. And really anyone, if it's something that you want and you put the time and effort in, like you'll do it. So it's definitely achievable. You can do whatever specialty you want. If it's ortho, you can do whatever fellowship you want. So as long as you put the time and effort in, talk to people, make those connections, show that, yeah, it's something you're gonna do, like you'll make it happen.
Yeah, I agree with Christina. Like, if just because you're a female doesn't mean that you can't not do ortho at all. But you gotta work hard, study hard, be nice to everyone, kill them with kindness, and just show that you're a team player, and that will get you really far. And also, I'm sure a lot of people have heard this, but like, be normal. That's like it's like you won't understand if you're a first or second year, you're gonna hear that a lot, and you're gonna be like, okay, but normal's not that hard. And then you meet people in rotations, and you're like, oh, that's what they meant by be normal. So like, don't be constantly on your phone just scrolling through Instagram and stuff like that. Like, if you have some downtime, take out pocket bims, or like if you're on your phone, like, be on ortho bullets or something at least, or like watching a video of the procedure you're gonna see next. And like, I don't know, it's also like, don't this, I don't know, this people kind of gets people in trouble sometimes. And like, I'm kind of sarcastic in a way. And like, sometimes I'll make comments and I'm like, oh, maybe I shouldn't have said that. So like, if you're like one of those people, maybe tone it down a bit because you're not as close to some of these residents and attendings and stuff. But yeah, like be normal, work hard, be nice, and you can do whatever you want.
Yeah, this is all kind of like the same advice that's been said, but I think like, even still, I think it's really important to I feel you literally just said this, so I'm just reiterating what you said, but just like being humble is super important. Like I'm humbled every single day. I don't know things. I get asked questions. Patients ask me things. Like I'm on plastic surgery right now and I had to go look at a skin flap today. And I'm texting my three. I'm like, I don't know what I'm looking at. Like, can I just send you pictures and you just let me know what you need me to do? Like you just need to feel comfortable like asking other people for help. And it's always better to ask and get the answers you need versus being overly confident and like not taking care of someone. But at the same time, you need to be competitive, work hard, study hard, and also like, be motivated. Like, don't be afraid. I think that's probably like the best advice I got. I would always kind of try and compare myself with other people and, just really stay in your lane and like focus on you. You're going to have a ton of people around you, a ton of things going on. Just really like hone in on you, what you can control, which is, you showing up on time, you being prepared for the case, you helping out in the OR, going to the social events that the residents have. Like, go do all of those things. Like, don't worry about literally anyone else except for yourself. And that sounds a little cutthroat. You know what? That's actually the piece of advice I got was from one of my like GME advisors from med school. She's an OB-GYN, very intense. She's wonderful. I love her. She goes, you need to look out for yourself. And it sounds horrible, but you really need to look out for yourself. Do not trust things people say. People will sabotage, they will do these things, and it's just the reality of it. So you need to really kind of have your own back. But at the same time, like auditions and applying and all these things it's a really cool time to make friends and stuff too, so be open to all of that. I just want to forewarn all of you as well that you really kind of need to just really like let yourself focus and to like let yourself succeed as well.
Yeah, one of the best like things I talked about, Morgan Turno's like she's a 2 down at Doctors, and I talked to her as a medical student, and then when I did all my auditions, like she helped me prepare for him. She was great. And I was talking to her about my rank list, and I thought, you talk to all these people and they're always like, oh, this was my #1 program, didn't want to go anywhere else. And I got to my rank list and I had like 3 or 4 places. I was like, I could go to any of these. I'm going to be a good surgeon at any of them. And I talked to her and she's like, where did you feel happiest at? What people do you want to hang out with? Like, you can go and get nitpicky about this place does education every day. This one does it once a week. These people have this rotation early on, but these people have this rotation later. And there's all these little technicalities and things like that. But when you're going through it, you just need to remember, and whether you write it down, I like ended up calling Morgan after all my rotations. And she was like, when you rotated here, you were happy, you enjoyed going in every day. And you need to remember how these people and these places make you feel and think about that, because at the end of the day, you're also interviewing them. And yes, we all want to match. You're happy to go wherever you can, but you're still trying to figure out where you're going to be successful for the next 5 years. And I think as a female, as going into ortho, like it's really hard to think about that, because you think about the stats, you think about how hard it is and all of these things on paper that you have to have these scores, you have to do this. And you're still applying for a job and you are interviewing these places also. So you have to think about where you're going to succeed and what's going to be best for you. What's best for you might not be best for someone else. What's best for you might not be this big program that looks fancy on paper, and that's okay, because at the end of the day, you're training for the rest of your life and your career. So you have to keep yourself in mind also. And like Whitney just said, focus on what you need to do and do whatever that is. And it is really fun. And the people you meet on auditions, I still talk to a bunch of them, and it's a lot of fun. It's a good community. And those of you that are in match this week, congratulations, and hope Friday goes well for you. Friday was more nerve-wracking than Monday for me, I think. Once you knew where you were going, it was like I was already looking at Zillow in like 4 different cities and all that kind of stuff. So it's a lot of fun. Enjoy it.
Don't be afraid to be aggressive too. I still get that advice all the time. So just put yourself out there. Don't be too aggressive, too annoying, but you also don't have to hide behind all the boys on your auditions or whatever you're doing. So you're doing the same thing they are. Work yourself, put yourself out there, show them what you can do.
And one last thing I think too, I think it's really important, like when you're going through auditions and interviews, and I'm kind of in a weird situation where I matched somewhere that I didn't rotate, but I came and interviewed here in person, and what really sold me was the interview and also the social afterwards because of the people. Like with my program, we have a ton of different personalities. Everyone's like very different, but we all like get along really well together. And I think too, especially as interns, we're really protected. And for me, that's been huge because I've never been to these facilities before. I don't know these attendings. I don't know what's going on. And to, have like my 2 and my 3 when I'm on trauma be like, anything that you do is on me. Like, I got your back. If you have any questions, text me, call me. Even when we take solo call as 2s, like everyone is so supportive. Like, I feel so comfortable reaching out to anyone that's like in my class to my chiefs. And I think when you're rotating and looking at programs, you really need to find a place that you feel like you fit in and you can like be happy, because residency is hard. You are going to see a lot of, pretty traumatic things. Like, quite literally, it's going to be traumatic for the patient, but traumatic for you as well. And you need to be in an environment that you feel like you can not only like learn and grow as like a resident, but also somewhere that you can feel supported and still feel like a human at the end of the day. Because yeah, it's awesome. Orthopedics is like the coolest specialty in the world, but it's also a job, and you need to make sure you're in a program that kind of reminds you of that. And you can go hang out and like get a beer, go golf, or do whatever it is like with the people in your program, because you're going to work a lot of hours with these people. So you want to be surrounded by people that like you really enjoy and that you care about, and vice versa.
Okay, and we're a little bit past 7, but thank you